Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network, recording today from our studios at the Capital Region International Airport. Go to Okemos, Michigan right now. We're going to spend a little time with Brian Peters. He's the CEO of MHA, the Michigan Health and Hospital Association. Brian, I know you guys run on a fiscal year, July 1 to July 30. So rather than do what we normally do, which is a mid-year update, let's talk about last year. How did it go?
Well, Chris, always great to be with you. And the truth is that it went very well. The reality, as we look at our environment here in the state of Michigan, and frankly throughout the entire country for that matter, when it comes to hospitals and healthcare, is it's a very challenging environment for a host of reasons. But as an association that represents all Michigan hospitals throughout the state, both large and small, urban and rural, we were very pleased with the things we were able to do to really support our members and their mission of caring for their communities. And so it really starts every year with the state budget negotiations. And we were very thankful that the legislature and the governor supported a budget that included support for our priorities, which include the Medicaid program, including the Healthy Michigan program, certainly funding for graduate medical education, for our OB stabilization pool, our rural stabilization fund, and a host of other priorities. I will tell you that workforce has been an absolute priority for the Michigan Health and Hospital Association and our members. And we were very pleased that the legislature and the governor identified an additional $75 million specifically to support the recruitment and retention of our frontline caregivers in Michigan hospitals in this year's budget. That's in addition to the $300 million that we secured for healthcare workers a year ago. And so, we're on the right path, but a lot of work yet to be done.
So in the key issue area, did inflation come into that at all? I mean, are your hospitals experiencing a lot of inflation?
No question. We're experiencing that in a number of ways. Certainly when you look at our supply chain costs, whether that's personal protective equipment, whether that's all of the typical supplies that a hospital uses every single day. And remember, we're businesses that are open 24/7, 365. Whether it is in the pharmaceutical realm, we've seen our cost of prescription drugs skyrocket in the last several years. And so that's really put an inflationary pressure on the bottom line. But the most significant effect of inflation is inflation in the cost of labor. And in the typical Michigan hospital, the cost of labor is well north of 60% of our total operating cost. We are a very human resource intensive industry. And when you see the cost of nurse travelers skyrocket as it did during the pandemic, it's moderated to some degree, but not back to where we were pre-pandemic by any means. And when you see the cost of labor throughout the hospital sector, that's not just clinical staff, Chris. That's everyone from environmental staff and maintenance, housekeeping, you name it. Those costs have gone up significantly. So yes, inflation is hitting hospitals as hard as any sector in Michigan.
So much like your clients, you in the advocacy business are 24/7. 365 as well. So let's talk about the state budget. Were there certain areas in that state budget where you had to focus?
Well, without a doubt, it was on the financial viability of our members. And when you look at the dramatic growth in the Medicaid program over the years, some of that in the traditional program, but frankly, a lot of that in the Healthy Michigan plan. Thank goodness we have that Medicaid expansion program, because during the pandemic, so many people lost their jobs and lost the health coverage that came with it. And only because of the Healthy Michigan plan were they able to have coverage. We know how important that is, because that means they're more likely to have a primary and preventive care that can identify problems earlier on. Folks can get the prenatal visits that they need. all of the things that we know contribute to a healthier community and healthier individuals. But if that program is not well funded, and if the provider reimbursement rates are not adequate, it's only a matter of time before our hospitals and our partner physicians and skilled nursing facilities and the like will not be viable, not be there for us to provide those services around the clock when we need them. And so that was our focus in this budget. And when the legislature and the governor supported those reimbursement rates for our members, when they supported those special funding pools for our members, that really meant a lot. It meant the difference between access to care and not having that access there when we need it. So that really was our first priority.
Brian, we got about a minute left. Were there any other large issues that MHA addressed not included in your focus areas?
Well, absolutely. Behavioral health continues to be a major challenge here in Michigan. I'm very pleased that we secured $50 million. That's new funding specifically for pediatric behavioral health capacity here in Michigan. And we've been fortunate at the MHA to facilitate an RFP process so that our hospitals and health systems that are actively involved in the provision of behavioral health services, they could gain access to that desperately needed funding to expand their ability to serve, particularly in this case, our pediatric behavioral health patients throughout the state of Michigan. And so that funding will reach our hospitals very shortly. That's going to make a difference, but more needs to be done in this year ahead, no question about it.
Well, I have to tell you, as usual, our 6 minutes is up and I have 2,000 questions left for you, but we'll say that for another time. Brian Peters, who's the CEO of the MHA, the Michigan Health and Hospital Association in Lansing, Michigan. Thanks so much for the work you do and for joining us. We appreciate it.
Thank you as always, Chris.
You've been watching the Michigan Business Beat on the Michigan Business Network. I'm Chris.